So your diagnostic results came through.
So doc, what is it? Is it like the common cold, or is it cancer, like Google told me?
Well, based on lab testing, you have an acute case of acute fever.
How do you know that's what it is?
Well, for accurate diagnosis of acute fever, lab testing was required. Because your symptoms aren't specific to your disease, the serological testing confirmed that you have acute fever by the detection of the antibodies Kira Robin Ankita.
A common method for this diagnosis is called immunofluorescence assay, where immunohistochemical staining and DNA detections are used to identify infected tissues for Coxiella burnetii. Immunofluorescence is a technique used for light microscopy with a fluorescence microscope. The fluorescence tag, or dye, aids visualization of the location of the antibodies. Since this technique uses the specificity of antibodies to their antigen, in this case Coxiella burnetii, to target the fluorescence dyes, the distribution of the target molecule through the sample of tissue cells are made visual. There are two antigenic phases that are immunologic responses important for distinguishing between chronic and acute infection. Phase 1 antibodies appear over a longer period of time, which indicates continued exposure to chronic infection, and Phase 2 antibodies are detected within 2 weeks of illness, which indicates acute infections. According to Pierre-Edouard Fournier, Thomas Marie, and Didier Raoult, in their journal article titled Diagnosis of Acute Fever, they state that when a patient has an acute case of acute fever, an immunofluorescence assay should be performed once a month for at least 6 months. And similarly, for patients with chronic acute fever, follow-ups are also done serologically. Thus, during therapy, serological testing should be carried out once monthly for 6 months and every 3 months thereafter.
See here?
What am I looking at? Your bubble gum?
No, this is not bubblegum. These are microscopic images of your tissue cells from your lab report. You see these white circles here? These are donor granulomas. They should not be present in healthy cells.
Donut granulomas is a central vacuole that is surrounded by epithelioid histiocytes and a dense eosinophilic fibrin ring.
Okay. So, from what I understand, this headache, nausea, coughing, diarrhea, vomiting, chills and sweats weren't enough for you to tell? But this picture of white circles tells you all the information?
Well, all your symptoms are signs of acute fever, even abdominal pain and myalgia.
The power's gone out in the clinic.
Well, you seem to be getting a little upset. Let's go for a little walk.
Alright.
You good?
Yeah, Doc, I think I'm feeling a little bit better now.
Okay, unfortunately, due to the power outage in our other room, we're going to shift over to this room and continue our talk.
Alright.
Have a seat.
So, as I was saying before, all these symptoms aren't enough to tell you what illness I have, but these white donut things are.
Well, all your symptoms are signs of acute fever, but just basing your diagnosis simply on your symptoms would be inaccurate. Therefore, the test was done to specifically prove that you have acute fever.
Okay, just, you know what, tell me what's going to happen to me now that I have this illness.
Are you pregnant by any chance?
Okay, look, like, I know I like to indulge in Rocky Road and chocolate late at night. Whew. Oh man, that biology class was crazy. Like, action potential? Pfft, who gets that? Oh, honestly, the prof is crazy. Oh, I need some de-stressor after that class, let me tell you. Oh, yeah. Got some ice cream. Perfect, man. Monday night ice cream. Alright. No, wait. Getting better. Guess I'll have to do. Oh. Oh, yeah. This is gonna do well. Oh, yes.
You make me smile like the sun, fall out of bed, sing like a bird, dizzy in my head, spin like a record, crazy on a Sunday night.
But, no, at the moment, I'm currently not.
Okay. I'm sorry, just checking. Well, over the course of months, several patients usually just recover without treatment. However, there is a 30 to 50% chance of patients with symptomatic infections that do develop pneumonia. However, you are one of the lucky ones who has an acute case, and this will not happen to you.
Acute Q fever is fatal to 1 to 2% of patients, whereas chronic Q fever is fatal to 65% of patients. Chronic Q fever could also lead to serious complications of endocarditis, which involves the aortic heart valves.
For an acute case of Q fever, the most popular treatment is doxycycline because it is most effective within the first 3 days of the illness. Antibiotic treatment is most effective, so therefore I'm going to give you a dosage of 100 milligrams of doxycycline for the next 15 to 21 days.
In the case of chronic Q fever, treatment is more difficult and will require the use of multiple drugs. Option 1 would be a combination of doxycycline and quinolones for at least 4 years. Option 2 would be a combination of doxycycline and hydrochloroquine for 1.5 to 3 years. Option 2 does result in fewer relapses. However, monitoring of possible adverse effects of chloroquine on the eyes is required through routine eye exams.
So, I just take this medication and poof, I'm all better?
Well, specific antimicrobial therapy is indicated. However, most patients do recover spontaneously. These antibiotics are there to stop the progression of chronic disease from occurring.
Well, I have to ask, is there any side effects? You know, I'm very sensitive to new medications.
Supportive care with fluids, antitussives, and antipyretics may improve your condition. However, you must avoid the ingestion of unpasteurized dairy products.
So, wait, no more Rocky Road and chocolate?
Unfortunately, no. Just to let you know, these are just the less invasive treatments possible.
Wow, this Q fever seems more serious than I originally thought. Is there anything else I should know about?
It's okay, you don't need to worry about invasive treatment as it does not apply to your case.
The most invasive treatment option happens to be surgical intervention, which would be necessary for certain cases. For example, surgical treatment can affect survival in endovascular complications such as myocardic aneurysm or vascular graft infections. Valvular replacement is indicated for intractable heart failure. Coxiella burnetii can persist on endocardial tissue even after valve replacement. Therefore, antibiotics should be continued following surgery. Surgical debridement is also recommended for osteoarticular infections.
Okay, so what I'm wondering now is, how on earth did I get this Q fever?
Well, do you live on a farm?
Excuse me? Do I look like I live on a farm?
I'm sorry, what I mean was that farm animals can transmit this disease to humans via contaminated aerosols stated in this article by Emmanuel Articulus and Didier Rowe. Here's the journal article, maybe you should read it.
No thanks. I don't live on a farm, and reading, just makes my eyes hurt.
Your eyes hurt?
No, it's just an expression. Jeez.
Well, anyways, our appointment's over for today. If you have any problems with your medications, just give me a call.
Yeah, sure thing, Doc. Oh, crap, I forgot to pick up Bailey from his appointment.
Is Bailey your dad?
No, it's my dog.
And you're wondering where you got Q fever from.
What's that supposed to mean?
Well, if you would have read this article, it clearly states that pets can also transmit Q fever to humans. Here you go.
Yeah, okay, Doc, thanks.